Let's jump right into this. Welcome to The Explainer. Today, we're demystifying Parkinson's disease and mapping out what this journey actually looks like. You hear about it in the news, or maybe you know someone navigating it, right? But how much do we truly understand about how it unfolds over time? Well, we're going to clear up that confusion right now. We'll look at the real data, break down the biology, and walk through a clear, chronological roadmap so you know exactly what to expect.
Let's start with a number that's just staggering. According to a 2022 World Health Organization report, looking back at 2019 data, there were over 8.5 million people globally living with Parkinson's. 8.5 million. And here's the part that should really make you pause. That number effectively doubled in just 25 years. And since that data is from a few years ago, it's highly likely that the number of people affected is even higher today.
The contrast gets incredibly stark when we factor in age. If you take a bird's-eye view of the general population, roughly 1 in 1,000 people have Parkinson's. But watch what happens when we look at folks over the age of 65. That prevalence jumps massively to 1 in 100. With populations aging rapidly across the globe, especially in places like Japan, where our source data was analyzed, this isn't just some rare medical anomaly anymore. It's a highly relevant, everyday reality that we're all going to be hearing about more and more.
So, with those rising numbers, the most immediate and, frankly, terrifying question people ask after a diagnosis is this a death sentence? Does Parkinson's actually shorten my lifespan? And that is a completely natural fear to have.
But the reassuring truth here is, no. Parkinson's disease, as a direct cause, does not generally shorten your lifespan. Thanks to some truly incredible strides in early diagnostics, advanced therapies, surgical options, and targeted rehab, patients today can generally expect to live a normal lifespan. It's not the disease itself that cuts life short, but rather managing the complications it brings. It's a condition you live with, which is exactly why understanding the road ahead is so absolutely crucial. To really understand this disease, we're going to follow a clear roadmap today. We'll hit the root cause, the premotor phase, the early stage, the middle stage, and finally, the late stage and support.
All right, Section 1, the root cause. Before we look at any outward symptoms, we need to peek under the hood at the biology.
Parkinson's is a neurodegenerative disease that traces back to a very specific part of the brain called the substantia nigra. Think of this area like a factory, and its main job is producing dopamine. Dopamine is that essential messenger that tells your body how to move smoothly. So when this factory breaks down, the brain stops producing dopamine, literally starving the body of the chemical it needs to orchestrate movement. We don't have a fundamental cure just yet, but understanding this dopamine shortage is the absolute key to all the treatments we use today.
Moving into Section 2, the premotor phase, let's uncover some of those hidden early signs.
We're starting our timeline right at the very beginning, the premotor phase. This is a critical window, but unfortunately, it's missed a lot. Why? Because the symptoms don't look anything like what we typically associate with Parkinson's. Actually, years before any tremors even begin, patients often experience these really surprising non-motor symptoms. We're talking about chronic constipation, a noticeable loss of smell, depression, and REM sleep behavior disorder, which is where people physically act out their dreams. Historically, these were completely brushed aside or just treated as totally separate issues. But recent research is putting a massive spotlight on these early clues. Catching these non-motor symptoms early on can drastically improve a patient's future quality of life.
That brings us to Section 3, the early stage. This is really the tipping point.
Stepping into the early stage on our timeline, we hit the point of official diagnosis. This is where the disease shifts from somewhat invisible to noticeably physical. This is when those core motor symptoms finally make their appearance. We see resting tremors, that subtle shaking in the hands or fingers when you're just holding a cup or resting your arm. Then there's bradykinesia. That's just the medical term for a general slowness of movement. Suddenly, routine daily tasks are eating up significantly more time. Muscles become rigid and stiff, losing their natural flexibility. And a really key identifier here is that these symptoms usually begin on just one side of the body before eventually progressing.
Now, what's fascinating is that not all early stages look the exact same. The progression can actually split down two different paths. Some patients experience what's called a tremor-dominant pattern. Others, however, experience a postural instability-dominant pattern. So why does this matter? Well, it turns out that those whose primary early symptom is postural instability tend to face a much heavier burden later on. They're at a higher risk for more severe cognitive challenges, hallucinations, and just a tougher progression overall. Pinpointing this pattern early helps doctors better tailor the road ahead.
Next up is Section 4, the middle stage, where we start to see growing challenges.
Grounding ourselves back on the timeline, we're now squarely in the middle stage. This phase is largely characterized by new complications. And ironically, they aren't just from the disease itself, but often from the treatments.
A major and incredibly frustrating hurdle here is dyskinesia. Now, dyskinesia isn't actually a symptom of Parkinson's itself. It's a side effect of long-term use of the very medications used to replace that missing dopamine. Over time, these life-saving drugs start causing irregular, involuntary muscle movements. It turns into this highly delicate, difficult balancing act for doctors, trying to manage the medication dosage without triggering those intense, uncontrolled movements. At the same time, physical balance takes a massive hit. Because a patient's posture steadily deteriorates, often leaning forward or sideways, their center of gravity gets completely thrown off. So the annual fall risk for someone in this stage absolutely skyrockets to somewhere between 45 and 68%. That means fractures and serious injuries become a constant daily threat requiring vigilant support.
On top of that, the middle stage is heavily burdened by invisible struggles. Patients battle dysautonomia, which is a malfunction of the autonomic nervous system. That can cause sudden blood pressure drops or severe urinary issues. Sleep disorders worsen, and this severe, totally unshakable fatigue sets in, and this creates a really tragic cycle. Because they're exhausted and moving is so difficult, patients tend to move less. That leads to disuse syndrome, a rapid physical decline that's simply caused by inactivity.
Finally, Section 5, the late stage and support involving complex management.
Pushing into the late stage of our journey, both the motor and non-motor symptoms become highly complex and deeply intertwined, impacting almost every single aspect of a person's daily life. In this stage, patients often face a terrifying physical phenomenon known as freezing of gait. Imagine trying to walk through a crowded room and suddenly your feet feel like they've been superglued to the floor. You literally cannot take a step forward. This is often combined with something called wearing off. That's when the exact same dose of medication suddenly stops lasting as long as it used to, leaving the patient stranded in these periods where their symptoms fully return until the next dose finally kicks in.
Now, the physical manifestations here are just completely paradoxical. While a patient might freeze in place one moment, they might suffer from accelerated walking the very next, where they start stepping faster and physically cannot force their body to stop, which leads to terrible accidents. Alongside all of this, the non-motor symptoms peak. The risk for dementia rises, and constant pain, fatigue, and depression often lead to a painful narrowing of their world.
We've mapped out the reality of Parkinson's, from those invisible early days all the way to the complex late stages. But I want to leave you with this final thought. Knowing this timeline doesn't just prepare us for the future. It's a tool for today. How can we use this roadmap right now to build a more proactive, empathetic, and supportive environment? Because whether it's helping a loved one catch early signs of a sleep disorder, or just having the grace and patience to wait when someone experiences freezing of gait in public, understanding the journey changes everything about how we care. Think about how this knowledge might shift your perspective the next time you encounter someone walking this road. Thanks for joining me for this explainer, and keep learning.